Thank you again for being here today. I'm Andrew Rand. It's Friday, April 3rd. Thank goodness. I'm chairman of the Peoria County Board, and I'm going to provide a couple of notes for today's meeting before I introduce Monica Hendrickson and Samuel Duran from the local congregation. I'd like to just take care of one item of housekeeping regarding City of Peoria residents. PDC, our local waste hauler, will not be able to pick up large mattresses or major household items that don't fit in your roll-around bins, at least until the end of the month. So that service is suspended. Please don't bring those items to the curb, and that affects the City of Peoria's trash hauler. Also, everything in the city must be able to fit in the bin, in particular the recycle items. If they're not in the orange covered bin, they will not be able to take them. So I want to get a little bit more serious today, and I'm just going to start by saying it's here. I'm involved in several conversations a day. As you know, you are reading and studying the same things I am. The statistical models are what you really need to pay attention to. My little upward arrow suggests the statistical models are telling us the numbers are much, much larger than we hear about each day. And as you know, many people are presumed to be positive and aren't tested per se, so those numbers don't count. People in a household who may have symptoms that are similar to the COVID virus's symptoms are presumed to be positive. They don't require a test. There are individuals who present to their physician or physician care providers or the hospital who have symptoms, but because of the scarcity of testing, do not meet the criteria for being tested. So these are the results that you're not seeing when you hear the person-by-person positives, negatives, pending, those in ICU, etc. Those numbers are not at all in any way indicative of the actual preponderance of COVID-positive patients in the community. These studies that I'm referring to here, they may not have been critically reviewed yet, but these are the ones coming out of China and some of them that are coming out of Europe that indicate the community spread of this disease is likely to be higher than the spread that's associated with the known contacts and connection points that we follow through once a contact case is created on a COVID positive patient. One of the reasons this community-based spread is so high is because a large portion of these folks that are positive are asymptomatic. Big word for meaning they don't really feel any of the traditional symptoms that we hear a lot about. Fever, cough that progresses into severe shortness of breath, things that require a trip to the hospital or a call to your doctor, things like tremendous general fatigue, or some of the other lesser flu-like symptoms such as loss of taste or diarrhea. This is a very unusual creature right now because these studies are suggesting to us that the 10 of us in this room, easily 8 out of 10 of us could be without symptoms and could actually be positive for the virus or have been positive for the virus sometime in the last few weeks. So because of that, the question of how this spreads from person to person becomes an increased question for how much more due diligence we should be applying to take care. It's really simple. If you've got a family or coworkers or loved ones, protect them. We've been telling you how to do that. I think perhaps we'll get a refresher on that later today. Protect your family. The extension by the governor to shelter in place for another month is a small portion of that formula. Social distancing, hand washing, don't touch your hands, face, eyes, nose, or mouth. Constant hand washing. Cover your cough, cover your sneeze. Don't be around anybody that's sick within that 6 or 8 feet of protection, that social distancing, unless you want to become a victim. These measures are essential for us to stop the spread. There is more virus in the community than the simple empirical numbers of those tested and cared for can help you understand. Finally, what does preparation mean? Believe, like everybody you come in contact with is contagious, and maintain your safe practices. If we presume, and it's not an awkward presumption, that everyone in a room is positive and we just maintain our distances, we can be socially delicate and loving. No elbow bumping necessary. Just nod your head from 6 or 8 feet away. It works. Smile big. I go to my little flashcards today because I think it's time this Friday, as the weekend comes upon us, to know that we're in this for another whole month at least. I can tell you from my day job, from the calls I'm on, we are seeing the numbers grow just like anticipated. And the biggest stick we have in the batting cage to hit back are these simple practices: social distancing, shelter at home. I want to talk to you also about what happens when you are out for essential services. Please make certain to give those people that are working in service stations, repair shops, grocery stores, the pharmacy, please make sure to give those folks a fair amount of safe distance too. They're out there risking their well-being to meet your essential needs, and you should be respectful of that. There's one more point I was supposed to make. Yes, Monica Hendrickson will present the rest of this afternoon's information, and she will be followed by the Reverend Duran. Thank you all.
Thank you, Chairman Rand, and thank you for really focusing on what these impacts of these numbers really mean in the grand scheme of what we've been reporting. To date, we are at 23 cases, 2 additional cases from yesterday in the Tri-County area. Peoria County remains at 9, same as yesterday. Woodford, 6, same as yesterday. And Tazewell has 2 additional cases, bringing it up to 8. These 2 new additional cases are not associated with any travel, nor are they associated with contact to an existing positive case, which again highlights what Chairman Rand mentioned, which is that it is in our community and it is being shared and transmitted amongst us. The Illinois Department of Public Health updated guidance to hospitals yesterday in regards to reporting. Moving forward, we will continue to report aggregate data for the 4 hospitals. Again, that's OSF St. Francis Medical Center, Unity Point Health Methodist, Unity Point Health Pekin, and Unity Point Health Proctor. There are 5 confirmed COVID-19 patients in the ICU. There are 11 persons under investigation for COVID-19 in the ICU. And there are currently 17 confirmed and or persons under investigation for COVID-19 in non-ICU beds. This is a new data point. IDPH is further defining, again, to have more meaningful data to bring understanding of that scope of what we are able to collect and understand about the virus. Chairman Rand mentioned it well, too, that today marks 1 month of our Emergency Operations Center being open as a joint effort between the City of Peoria and the County of Peoria. I think it is important to stress that while these numbers still seem small, it is imperative to understand the full scope of our response, which is not just measured by one single data point, but rather by the various data points that the EOC has been gathering from our community partners. So again, that would include for Peoria our 9 confirmed cases. We know of 2 additional confirmed cases that our county is currently investigating, bringing our total to 11. We know of 2 presumptive positives that were never tested, but based on the relationship to those confirmed cases, we understand that they were positive. We have over 90 negative tests that we've done in the past month, and we have 67 active monitoring currently being done by contacts. These are individuals that are daily reporting their symptoms or lack thereof to us at the health department to follow. This does not include those that are currently self-monitoring, who, based on their risk, we're asking them to just respond to us when their symptoms change. The active monitoring are those individuals that were in close enough contact that we are asking for daily updates from them. In March, 211 had 264 calls related to COVID. OSF's telehealth in 1 week alone had 300 calls related to COVID. And since our response, 134 calls came to our 911 dispatch related to COVID response in March. Again, these numbers are much larger than the 9 confirmed cases. And as the chairman mentioned, those that are asymptomatic can still transmit or have such small or non-existent symptoms that they don't recognize that they are positive for COVID. So as we continue this, painting this picture of understanding what the impact is in our response, is important to understand that when we can provide meaningful data, we will, and we do hope that this helps you understand fully the impact that this is having in our community. This Sunday is Palm Sunday, and in these difficult times, faith, spirituality, and hope are essential. However, gathering in a location is not essential. History has shown in all of our major religions, whether it's a temple, a church, a synagogue, a mosque, or a shrine, once they've been destroyed, that doesn't stop or replace faith from happening. To further discuss this, I am pleased to introduce not only the Peoria County Board of Health President, but pastor of Zion Baptist Church, Samuel Duran.
Thank you, Director Monica, for that great introduction, and thank you, County Councilperson President Rand, my beloved community members. Again, Samuel Duran, pastor of Zion Baptist Church, humbled to serve.
Speak up.
Sure can. Humbly to serve here as the president of Peoria County Health Board, and definitely concerned about our community. As Palm Sunday is approaching us, and then following that Easter Sunday, one of the larger time of gatherings and times of faith, but also for all faith traditions, all religious congregation members, encouraging you to heed to the leading of the government the governor has given us. And so saying that as Easter Sunday approaches, we can still celebrate, but in different ways. I encourage the faith community to honor the governor's orders for social distancing and keeping gatherings to small numbers. Your leaders, I ask all faith leaders, your leadership by example will help flatten this curve, will help slow the spread of COVID-19 in our community. It also will help us to lead other members to set the same practice of social distancing and practicing 6 feet guidance. And so we want to limit large gatherings in parking lots, limit social cookouts and gatherings, anything we can, and realize that our leadership is going to lead us in this area. So I encourage you to stay connected to your members through the many areas of social media available, Facebook, Instagram. I'm giving free publications because they're free, so take advantage of those opportunities. And may we learn through this season and this to be content in this new season. As Paul wrote, that he learned to be content whether he was poor, or whether he was rich, whether he was hungry, whether he was full. May we learn to be content as we're going through this season. And I say it's a season, for it too shall pass, but we just don't know how long, but we have to endure. So I encourage you to endure, show strength, show leadership. And may we learn to be content and lead our community through this crisis and through this situation. Though the media, the form that we're going to deliver our messages and gather on Sundays has changed, the message has not changed. So let us stay focused to continue promoting a message of hope, a message of life, and help preserve life and saving lives by honoring and following these guidelines is my plea to you. God bless you and may he keep you. Thank you. I'll turn it back over to our Director, Monica Henderson, to moderate the Q&A.
Thank you. So with that, I'll open it up for questions from the group.
Monica, could you kind of clarify, because I think, I know some of our listening public got a little confused. So we have 9 confirmed in Peoria, but you also talked about presumptive positives. Can you please clarify that?
So we have 9 confirmed cases in Peoria, and if you were to go to the Illinois Department of Public Health website, there lists us as having additional 2 cases. These 2 cases are individuals that are currently under investigation by our health department, but they don't reside in our county. But based on their care, they are currently being staying in our area, investigated by our community. We have 2 what we call presumptive positives. These are individuals that, as Chairman Rand mentioned, we would not test because based on their connection to a known positive, we're going to presume that they are also positive. So a great example would be someone that you live with. If a husband is positive, their significant other that's been living with them would be in close contact. If they start developing symptoms, rather than test, knowing that they're connected, we would presume them as a positive. Now, we know of 2 of those, but doesn't mean that we're limited to that because, again, we are still actively monitoring multiple individuals, whether they live in the same household, their neighbors, work colleagues. It's not an isolated pocket of individuals, but rather spread throughout the community. And those are the 67 that we are actively monitoring. On top of that, almost by 4 times more, you are asking people to self-monitor and just traditionally report if they have any symptoms change. Those are individuals that we notified that they might have been in some type of exposure. But again, we're now in a situation in our community where everyone should really take heed and recognize the fact that it's not whether or not you've been linked to a positive case or been contacted by the health department and said that you have had some relation or contact with an individual. We really need to be focused on assuming that we have been exposed and then acting as if we have. Even if we are all asymptomatic, we can still spread the virus.
For the 2 new Tazewell County cases, do you have any more specific information, like age, and then how they're doing, if they are in the ICU, if they're at home, recovering, anything like that for us?
I do believe these 2 new cases are currently hospitalized.
We keep talking about the increases of numbers, but are there any cases that are almost recovered and ready to decrease those numbers?
We have some that are on that kind of recovery path and have tested negative when that was one of the policies early on. However, understanding that when someone develops pneumonia or those secondary infections that happen with the virus, that also changes their health. So they may be cleared for the virus itself, but they have ongoing health issues, which again poses why this is such a high-risk virus, that while majority of people will have mild symptoms, those that do and recover because of the comorbidities, because of their age, they're never going to fully recover. They're never going to go back to baseline. And really, they're going to have a long road ahead of them.
Monica, today McLean County started releasing their COVID-19 data organized by race. Is the Tri-County area prepared to do that as well?
We're looking into that because we do this as a tri-county, and our 3 counties have different levels of staffing as well as how we're responding to it. We are sharing the data that is universally collected by us, but moving forward, that is something that we are looking at, especially as the state's giving us much more robust reporting tools.
And I know the state, I think the last time the state released numbers broken down by race was last week, so it seems like a millennium ago. But I think it was about 28% of the total people that tested positive were African American, but there had been kind of a disproportional amount of people of color essentially who had been contracted positive for this. I mean, is that a concern? Is that something in your thought process?
Right now, it's not necessarily a concern because from our state or national data as well as globally, it really is following on the fact that no one is immune to this. So when we are looking at that data point, we're looking at some of our largest urban centers where you might have a larger proportionality of minorities living in there, so you might be seeing those initially. But overall, there is no safe location for this. Really, the best thing you can do is shelter in place, do those non-pharmaceutical interventions, and really take care of yourself and your loved ones.
Going off of what Tim said in his first question, McLean County also announced today that they are looking at starting to share the zip codes from which those positive confirmed cases are coming out. Is this also something that the Tri-County area is thinking about?
Again, we are going to look into what we are wanting to share. Again, it has to be understanding to be meaningful and effective. If we were under the thought process that by sharing demographics, zip codes, that would somehow impact or change the course of this virus, then possibly. But really, the recognition is the fact that there is no place that is immune or protected from this. And what I would hate to create is a false sense of security that that is not my zip code. I am not an 80-year-old male living in that neighborhood, so that's not me. And I think that would be the wrong narrative to share. The true narrative to understand is that people that are asymptomatic can share and spread this virus, and we really need to be protecting our vulnerable population. And that's an entire community's response.
The governor talked about it today, but I know it's been talked about on a national scale as well, talking about kind of the entire general public wearing masks anytime that they go out in public. What is kind of the Tri-County Health Department's recommendation on this?
I would say from the Peoria City County Health Department standpoint, masking is a non-pharmaceutical intervention. Our biggest concern about masking, of course, is that we want to make sure that that supply is available to our first responders. Those individuals are going to be directly part of the care. And so it's really, again, a balancing act, understanding the fact that if you have to go out for an essential service, utilizing a mask might be something that we would recommend. But that's understanding whether you have enough supply in the community. And right now, our priority is making sure that PPE or protective personal equipment is given to our first responders in our healthcare community who are directly involved in patient care.
So are there things like scarves, bandanas, are those acceptable substitutes for people going out to the grocery store who want a little extra protection?
I think it goes back to understanding all the non-pharmaceutical interventions. So not relying just on having something covering your face, but good hygiene, practicing social distancing, making sure that you're really going for those essential services and keeping that kind of safe space around you. That's really going to be, there is no silver bullet in this as much as we wish there was. And so it's the totality of practices in general, all of which leads to just really good hand hygiene as well as understanding how the virus spreads.
Is there a shortage right now of PPE among first responders and at the four hospitals?
The question about whether or not there is PPE currently available for our first responders in our hospitals, we are actually been very lucky in fact that we've been getting resource requests coming in from the state. Having said that, though, we understand that we're not getting our full request value. So as of today, we have enough PPE in our community. But then again, that is of, April 3rd of 2020 versus I would not necessarily be able to say that with the same authority for 1 week future out.
And to follow that up, one of the things that folks want to do, if you follow the web at all, is that people are making all of these cloth masks, and they're doing it to help out and whatever. But are those people want to wear those out? Is that a response that is good, or is that going to give a false sense?
So the idea of the fabric or homemade masks that people are grouping together and providing, that type of PPE or that layer, again, as an individual, that's your decision to make, but that should not be the one and only mechanism that you're doing in terms of an intervention. Again, good hygiene, practicing social distancing, only going out for essential services. In totality, that is a correct response, not necessarily just one and done by feeling that if I put on a fabric mask, that's all I need for this response. It's not. It's part of a larger, comprehensive approach to dealing with this virus.
And as of right now, the McLean County testing site that's being staffed by National Guard, they've used like less than half of the tests they have available every single day for the past week now. So are you encouraging people from here who meet the criteria to be tested over there to drive themselves over there or to ride over there to take advantage of that testing?
So the question about the McLean community-based testing site and the capacity they have not hit their numbers that they've been expecting to, or maybe a better way of saying that they're never at the highest capacity. And so yes, we are recommending that is a community-based, it's a federal assets that anyone in our region can utilize if they can safely get there. And we are encouraging individuals, especially our first responders, to take advantage of it. Yesterday, we just saw the first data coming in from results. Peoria County, we had, I think, about 13 individuals that utilized that service, all came back negative. And so, again, it's something that it is available, and people should really feel comfortable utilizing it. And my understanding from the sheriff's department, I believe someone had utilized it. It's about 15 minutes, the whole process for them. So again, it is a resource we have. It is really focused on individuals that are symptomatic. And so again, something that an individual can definitely utilize.
Monica, there are so many projections on when this pandemic could be over or start to decrease. Some say weeks, some say 2 months. What would the community need to look like in order for that to happen, and do we really have an idea at this point?
So the question being, at what point do we feel that we've weathered the storm, I think is the best way to sum that up. It is a really difficult answer. My background is actually epidemiology, which is a fancy name of saying data nerd, I think. But with that in mind, the issue comes into play is that modeling gives you a point in time of the data you have on hand. So every day, if we do our interventions better and better, what ends up happening is that model changes on a 24-hour cycle, just really understanding using our past history to kind of predict the future. So there has been data that shows in about 2 weeks we're going to hit our peak here. Maybe it'll extend out. But I would really argue with the fact that the peak is not for the general public. When we hit the peak, it doesn't mean the next day that we are free of the virus. The virus is still going to be in our community, and it's spreading. That peak, or that value that we all kind of think about, is really about the true disaster, which is overcapacity of our healthcare system. And so what we're really want people to recognize is that come the end of April, when the shelter-in-place order might get lifted, it doesn't mean that the next day there is no virus in our community. It just means that we've gotten to a point where that disaster of having a exacerbated or utilized healthcare system is at a point where they can handle the rest of the cases we have. It doesn't mean that you're going to be virus-free. It doesn't mean that our grandparents or our elderly or people with comorbidities are going to feel like they have an armor on them. That's not what that peak is relatively about. And so I think that's the key thing to understand, is that we talk about that peak. It's not for the general public. It's for our healthcare system's capacity, and recognizing the fact that the virus and what it can do will still exist even past that time period.
Is there a concern that we might go to really low levels or something like that, where things are getting a little more calm? 6 months down the road, this could come back and become a super big problem if we kind of go back to the way that things were before all this happened?
So I think the question is, after one peak, will we see another peak after we may relax some of the interventions? And that is a concern, to have that secondary peak or even a tertiary. With any virus, especially coronavirus and even influenza, there's a little bit of a seasonality to it. So we might come through a point where we see low cases, low transmission, but then again, we might pick up again in the fall and into the winter. And with any virus, it can change. And so, again, it's recognizing the fact that those interventions that we're putting to place today is really trying to help us extend this out so we can kind of keep a level that our healthcare community can address.
Have we been able to get the rapid test that the Abbott lab had recently just made? The governor was talking about those tests, which could be done in, I believe, 45 minutes or something.
So there are tests that are rapid, anywhere from 15 to 45 minutes, depending on if it's a positive or negative result. Those tests, I believe, are coming into the market, but they are being prioritized in those communities where there is a high density of known community transmission. So in Illinois, that would be within the Chicagoland area. My understanding, though, is that it is moving into central Illinois, again, because our healthcare system does have a large reach and span that covers, I think, over 19 counties. And so we would be one of those other communities that would be in line to receive that. But again, they are prioritizing those in areas with high community transmission.
When you talk about spread, and you mentioned, Matt here was talking about what might happen in 6 to 8 months. One of the things that the pastor might know is that Easter is coming up, and parents and grandparents want to hug their grandkids. At what point are we going to be able to go back to that? And I ask that because we really don't know whether the virus can be passed on once you exit out a certain time frame. So has there been any, can you give maybe some thoughts that maybe you could add a bit of hope to the average person? Because I really think that that's really what folks want to know.
The question being at what point where we can relax some of those restrictions that we're putting on ourselves and be much more, I would say, our natural state of being affectionate and understanding. You know, and in my own household, my young children would like to spend Easter with their grandparents and their great-grandparents, and they were using social media and other mechanisms to kind of make that connection. But your point is valid, and it's the understanding of when that timeline is. And there is no crystal ball to know when we're in a clear. We just need to understand the fact that as this virus continues to transmit, our biggest asset or tool that we have is that social distancing, to make sure that if we do relax it and then grandma does get sick, that they have the ability to get to a healthcare provider and get a high level of care that they need and not be in a surge capacity issue.
Right, but when you're talking about all the measures that we're taking, you yourself said this is a new strain, that we have no built-up defenses. There is no treatment against it. So it seems like until we develop a vaccine or medication, we're going to be in this.
And I think that it can be said not only for this COVID-19, but for infection and communicable diseases across the board, even for influenza. Every year, influenza, while there is a vaccine, is not always a perfect match. And so, again, those practices that public health has been advocating for a while, hand hygiene, social distancing, staying home when you're sick, all of that continues to be the best practices we have, whether it's a novel strand or if it's even our own seasonal influenza. I will, don't know if you guys have any questions for anyone else. If not, we will see you guys on Monday unless things change. I think as of right now, we will not be having a briefing next Friday during Good Friday.
Thank you, Monica.